Hi, I'm Dr. Tom Hite with CardioSound. You're watching this video because either you've survived a heart attack or you've had a friend who's had a heart attack. And it's great to have survived a heart attack, but now what? What do you do after the heart attack? And I think really the most important thing that you can do after a heart attack is to ask the right questions. What's the most important question to ask? What are my chances, doc? What's my prognosis? How much risk do I carry going forward? What's my outlook? We don't tell you that a heart attack continues to be dangerous for years after you survive the heart attack. So today I want to answer that question. Let's look at the scientific evidence, the heart attack survival statistics at 30 days, 1 year, 5 years, and 8 years. The 30-day mortality rate, 1 of 13 women, 1 of 22 men don't survive 30 days. There are two factors that can increase your risk. One is if you don't have traditional risk factors like cholesterol, blood pressure, diabetes, or smoking. If you don't have those traditional risk factors, your 30-day risk doubles. The second factor is if your heart attack was a STEMI. Here's a study with 62,000 STEMI patients where they looked at 30-day survival both with and without traditional risk factors. Of the female STEMI survivors, about 1 in 10 died in 30 days. Males, 1 in 16. So a STEMI is more dangerous, especially in the first month or so after the heart attack. But you have to know the worst survival statistics of all at 30 days were STEMI survivors who did not have traditional risk factors. Of women, 1 in 6 died in the first month. That's 17%. Of men, 1 in 10, 9%. So, not having traditional risk factors and having a STEMI are two factors that can increase your risk. What about the first year after the heart attack? Of heart attack survivors 45 and older, about 1 in 4 women and 1 in 5 men will die within a year. What's the 5-year risk? About 1 of 2 women and 1 of 3 men won't survive 5 years. 8 years, 65% of women die and 1 of 2 men die in 8 years. So I think those are hard to hear, those statistics. If you've had a heart attack, if you've had a friend who's had a heart attack, those statistics are not fun to hear. At CardioSound, we have a 100% survival rate after the heart attack. And I think part of the reason we can talk about our statistics is that we talk about the prognosis. And when we talk about the prognosis and tell people they're in the fight of their life, they have a window of opportunity to change the course of their life, I think it helps them to get engaged with the dangerous situation they're in. And I think what needs to change, the hard decisions they need to make in order to reverse their artery disease and heal their arteries. If you've survived a heart attack, ask the right questions and keep on asking the hard questions, even if it's not easy to hear the answers. What would it be like, though, to see your arteries improving and to see your plaque disease being reversed? That's what we help people do. So if we can help you, let us know. Contact us. Thank you for listening.